now I am thrilled. Hello, Mary Lou Jepsen. After 4 years of being introduced by Esther Dyson, our mutual friend, we are thrilled and honored to have you on this fireside chat. Let me do a little bit of background first, and then we'll get into our conversation. So we're going to talk about how to make moonshots into moon landings and other tales in deep tech entrepreneurialism. And what I love is we had a session earlier today about actually investing and building businesses in space. And now we're going to talk about how to land on the moon and other exciting stories. So Mary Lou is an impressive serial entrepreneur, recognized by Time Magazine as one of the 100 most influential people in the world, a PhD in optical physics. She has built the latest startup, Openwater, which she's building now with the objective of seeing deep into the human body in high-res 3D. In the past, she's delivered billions of dollars of high-tech products and is leading Openwater to revolutionize neuroimaging and save lives. Previously at Facebook, Oculus, Google X, I can go on and on, Intel, founded 4 startups, and has been a professor at MIT, an inventor with over 100 published or issued patents just in the last 5 years. I could continue to go on, and I basically want to summarize by saying you're an inspiration, and I saw a couple of videos recently in preparation for this chat, and we're very thrilled to have you here.
Thank you so much for having me. I'm really excited to be here, and I wish, with pandemic, it was hard, but yes, Esther's a force of nature, and I'm sorry this isn't in person, but it's fantastic.
I'm sorry it's not in person as well, but we'll make the most of it. We've got many people in the audience. We've got a mixture of entrepreneurs and investors, lots of deep technical researchers and PhDs. So, in general, it's about talking about experiences and how to hopefully inspire people to build their own moonshots and have them land. And I want to kick it off by starting kind of like the context and the history. And I know you kind of, as a younger woman, you loved math and art as a kid and actually grew up on a farm. How did you get into kind of want to be a PhD in optical physics? Like, how did one go to the next? I know it's probably a roller coaster, but
yeah, well,
how did...
Yeah, when you grow up on a farm, you have to figure out how to fix things like the tractor and everything with
sure.
nothing. So when you like math and art and it's theoretical, it's you actually have to pull that tractor out of the swamp or plow the, whatever the thing is that we had to do. So I got very practical. My dad was an auto mechanic, and so I really also learned how to fix cars back when it was easier before the computers were in there.
Yeah, I wouldn't be able to fix my car now.
It's harder now, but you can buy a thing to debug with the computers. You can still do it, but it's not as fun. So I just loved optics. So I ended up not really thinking about doing anything beyond my parents wanted me to be able to get a job. So I majored in engineering, fell in love with art too, took enough classes that gave me a degree in art as well. This is at Brown and RISD in the early 80s. And the MIT Media Lab was opening up. And the thing that I really fell in love with as a teenager was making holograms, like really holograms with lasers and big optical tables and things that capture not just the intensity, but the phase of light so that you get these magical things. And they had gotten like one of the best holographers in the world as a professor at the Media Lab when it was opening up. So I applied and I got in. I had no idea even that grad school was free, and I got to go for free. They pay you a stipend, and we just got to hang out and be, and it was so fun to do it. And I ended up leaving for a while. I got a job. I was a computer science
just
professor.
1 second.
Oh, sorry.
1 second there. You said just in 1989, right? Was that roughly then? Is that you unveiled the first holographic video system? Is that?
Yeah, I did that as a master's student. So co-created the first holographic video system. Wow. Where really, if you remember in Star Wars, R2-D2 projects out Princess Leia saying, Obi-Wan Kenobi, you're my only help. Well, we did that for real. That was a special effect because you're seeing it on a movie screen in 2D. But for real, we did that. And that was computer generating the actual interference structure on a then, it's funny how things come back, a connection machine, a massively parallel computer. And I made a screen with 1 micron pixels in the 80s. And it was hard. But yeah, it worked. And but there were no jobs in holography.
Did you? Yeah, that's true. There's not many, no. But thinking back then, I mean, you know, one of the biggest challenges a lot of people have when they want to start businesses and it's a long journey, a lot of people think things might happen sooner. So in 1989, when you did that, did you believe that holography, I can't even pronounce it correctly, would be more mass adopted much sooner? I mean, it's been about 33 years since then. And yes, we're now, you know, making more progress in that kind of augmented reality, but it seems like it's taking much longer than people thought.
It was a big step in augmented reality. I mean, I think what we have with the Oculus headset is like a Jaron Lanier headset circa from VPL, the first, he coined the term, he's a good friend of mine, that actually works pretty well. But from the late 80s or early 90s, it's now kind of working. And I, you know, as an inventor and a technologist, it could be so much more than a shoebox on your head.
Sure,
and I know
exactly.
I've been in the rooms when decisions were made to do that, and the billions of dollars spent. Yeah, it works. Yeah, it's usable, but there's a lot we can do with augmented reality. And do we even have to put anything on our face? Why can't we just exhale the screen? Or why can't the screens, be on every surface and come to life in full 3D? In fact, a project I've been working on during pandemic, I call it my Venice Biennale project. I don't know, really? I'll get to the Venice Biennale, it's aspirational, but it's really, I'll tell you what it is. It's just, why can't everybody have $1 million view? Like, just really, like, there's no reason. It's so easy to do it at far field, and it changes. I happen to live in a boat, in a big houseboat in Sausalito, and I have this fantastic view. Why can't everybody have that? It's like a right now in China, you need 5 hours of sunlight in any apartment. But anyway, it's a small thing, but I think there's so much more that can be done, that has been done. But there's a new generation that's come into it, and, you know, how decisions are made aren't always on even people understanding. And so, like, you end up being a chief communicator, right? When you have this long experience, and then people don't want to understand the 3 or 4 syllable words, you explain it to them 2 syllable words, and they kind of want to diminish risk.
Simplify.
So what's the risk?
Exactly.
Given that we, I mean, the architecture hasn't changed much. It's sad, but
no,
we can change it. It's totally in our power to. And there are 4 big problems for VR, of course, like the content, you know, the interaction, the actual headset or whatever, however you get the image. You can do it through BCI, then you don't have to wear anything. And then the sensing on the room. And I think there's been a lot of progress on all 4 of those.
Let's talk about that a little bit more. I want to give just a little bit more context. Another one of your unbelievable earlier projects as an entrepreneur, if you started several companies, but was your one laptop per child initiative when you're at the MIT, and basically telling people that you were going to build something that nobody believed. And Bill Gates and Steve Jobs and Michael Dell and Craig Barrett, I've heard stories of you talking like they all said it was impossible. Sure. So tell us, what went through your head when people were telling you it's impossible? And it's probably a reoccurring theme as an inventor and I've heard it many times that I'm absolutely crazy. It's technically impossible. But how do you deal with that? And tell us about that one example of how you delivered and that became a thriving business helping kids around the world.
Well, they didn't want it to happen because it threatened their business model. But, I think the first time I gave a public talk, somebody stood up who a lot of people in the room thought should have won a Nobel Prize. That's how great his work was, and told me it was impossible. It never worked. It felt like it went on for 15 minutes. There's probably just a few. But my advisor at the time told me, when somebody does that to you, there's 2 things. 1, that person's a little bit jealous. And 2, keep going because you're on the right track. And that sort of sticks with me because, and I went up to him at the cocktail party that night and I'm like, you've done all these impossible things. Can't you let it hang in the air and tell me like a reason it won't work? Because here's my reasoning. And to his credit, he sat down with me at the bar that night and worked through the problems and became a friend and a collaborator. And so sometimes you can do that. In the case of when Intel and Microsoft don't want you to succeed because you're not using their chips or their software, that's a different story, because we were disrupting at that time in the early 2000s, laptops cost 2K plus the 1 to 2K of software on them. And basically those companies knew how to sell something at that price. And if we were successful, that was a threat, because what we were trying to do is make something that could go to every kid in the world at the cost of textbooks. And the really strange thing is, coming at this from a different, I'd never designed a laptop before. I've been the CTO of a group at Intel that I convinced Intel to close. And that's how I ended up becoming a professor, because we were making liquid crystal and silicon chips. I founded the first liquid crystal and silicon company. It was used in the early headsets in the 90s, and also wristwatch video and early large screen TVs and lots of things like that. We were making the fundamental core technology for that. And then we ended up having to help people with the opposite. So I knew a lot about making stuff at scale, but what people in hardware, and I have a degree in electrical engineering, that was my first undergraduate degree, they didn't consider the hardware, the screen. They didn't think they could change the screen. And the screen at this point, as laptops were enabled by the screen, remember we used to draw a computer as a big CRT, we didn't put the computer in it, and then it got flat. And so that's this huge innovation that people don't realize has happened in our lifetimes. Like, the screens got cheap, but they were still the most expensive component in any device. They still are today, and they're the most power hungry.
And one of the most important pieces of the device, because actually visual tech, if we can't see the hologram, or we can't see
that's how we get the information, is mostly through our eyes. Visual.
Exactly.
And so I approached it as a screen designer. I designed it from the screen backwards so that it could also be low power, because I was trying to ship this in a place where my customers, the children of the world, half of them lacked steady, ready access to electricity. So I designed a different type of laptop that we had retinal resolution on it before Apple coined the term. In the lowest power laptop ever made, still is. You can hand crank it to charge it up. And,
oh my God, I love it.
It's sunlight readable screen, which lowered the power a lot. So they've got they're still working in the field. These things we shipped in 2005, 6, even the beta ones. I think we went to mass production in late 2007, but they're still working, and they're fixable by the kids. So anyway, you can, if you can have a different perspective, maybe from an adjacent field, you can be very disruptive if you come in with a set of expertise. And the other thing that happened is I partnered with my much more famous co-founder, Nicholas Negroponte, and we got a lot of attention. He gets attention. He's amazing. I was talking to him yesterday. Anyway, so he, with that, we were able to get attention of I was invited to go meet with the chairman of very, very large consumer electronics companies and pick your Asian capital city. And what would usually happen, this happened once, I'd walk in, and the chairman of this gazillion-dollar company would be flanked on one side with 4 EVPs and the other side 4 EVPs. And it was just me on the other side of the room.
Right.
And they just started laughing.
No, come on. Really?
$100 laptop, ha, ha, ha. So I'm like, okay. And the women in the audience will get that. I pulled out a notebook and I'm like, tell me why it won't work. And I sat dutifully taking notes for the next, whatever it was, hour and a half. And at the end of that, towards the end, I said, okay, you've listed 23 reasons why this won't work. 16 of these we have handled. I can tell you why, but these new 7, these are really good. A lot about consumer electronics. I'm going to take these back to the team. The team then was just me, but they really did not need to know that. But me and Nicholas, but I was the CTO. I was the architect of the $100 laptop. So I thought about them, and what I realized is, oh my gosh, you pick any Asian city 50 years ago, they were poorer than pick your African country. These guys know, and they were all guys, how computing changed their lives. They're not opposed to this. They just want it to work, and they're giving me the answers. So I started reaching out and going to people who could just debug it in the room, because they could think through all of the problems. And so with that, I fought the urge to make a prototype till we'd done that, made a prototype. Kofi Annan unveiled at this huge world summit on the digital divide. And after that, every head of state in the world wanted the laptops en masse into their countries because we had solved this sort of complex multidimensional problem by getting the feedback of the most accomplished people in the area.
So it was a classic example of a moonshot that landed, and also, as we were talking to Martin Varsovsky earlier today, how can we build technology businesses that also hopefully improve humanity? And I think there's a lot of, that relates to also what we'll talk about in a minute with Openwater. But there's what you mentioned, like two pieces of people saying you're crazy. One is they're saying you're crazy because they've potentially have an ulterior business objective, and they're going to say whatever they want to say to benefit themselves. But then there's also this other technical, like, that's not possible. And what I've come to accept over the years, and where our sweet spot when we invest is during diligence. Any other people that we talk with say, Evan, that's technically, physically impossible to do. But if it works, it's going to be a huge opportunity. And if that team is the right team at the right time, building the right solution, and we love that. It doesn't scare me anymore, but it scares a lot of people. And so how do you deal with that statement of, hey, it's not going to work, but you technically believe and have the vision that it's going to work? Because it's hard hearing people say, no, you're crazy so long until you get used to it, I think, at least for me. I don't know if you feel the same.
Yeah. Well, one of the reasons I love startups so much is, the big, let's face it, the big tech companies aren't known for, except for Apple, I suppose, their hardware. The people that rise to the top that get to make the decisions are really good at optimizing click-through revenue for ad sales, for example. And so if a single vice president can kill your program because they don't really understand it, and their intuition is really good at the thing that the core part of the company, and you're doing the new part of the company, I just say it's harder to do a startup within one of those companies than to just do a real startup with, 1/100th of the funding. That's true, because at the levels I was able to get to in the big companies, you get a lot of funding. But it's easier, and you can go faster and more direct to the problem with, just the unveiling of, what do we think is true? What do we know is true? What would have to happen to prove this is true? Like just the logic of it. Right. And yes, there's technical details in all of that. And if you don't understand them, like, it's fine to not know something. It's the don't know, don't care part. Right. And the reality is, companies at their highest, I've joined as therapy. I'm on two big public boards. Like most of the time is spent on your top three problems as somebody running a company day in and day out, plus the pandemic or the war in Ukraine, or like all, they've got to just deal with all that stuff. And so the mind share that you can have, they're smart. They just don't have the time to think about it. And I think there's nothing better than scaling your startup if it's the right thing, if that company wants to invest. But to start it, one VP can't tank it. Like, you get a VC to say yes. You walk through the process. You hear what they say. It's fine if they don't take your write a check. You just actually want to know, well, why aren't you? And they're like, you just tell me the top three reasons, because then I can address them.
Exactly, like you taking notes with all the reasons they said it wasn't going to work, or talking at that event after the person stood up and said it's not going to work, and you went through and discuss it. So it makes a lot of sense. So you left Oculus in 2016 to focus on Openwater. Tell us about this exciting, your mission and kind of where you're at with Openwater.
I just thought I love VR, and I did a lot of great things for them. A lot of my work's on the Oculus too, and other things that are coming out. I really believe in it. I really want it. But finally, all of these people were all of this talent was going into VR and AR. And I think, great, they're going to do it. They're going to do it. I'm going to help them. I wish they'd go faster, but I know it's hard. But I didn't think anybody saw that with the advances of components and manufacturing processes developed for next generation high fidelity virtual and augmented reality, plus LiDAR and some other things coming on with autonomous driving and so forth, I didn't think anybody saw that. Oh, by the way, you're using infrared for that, infrared for that. Guess what? Our body's translucent to infrared. Like, that's why the invention of fire was so important. You sat around it and it warmed you, because the fire is infrared light. It goes through your body. It warms your belly. It warms your ribs. But the other thing that happened was these camera chips. I knew they were going to be going into smartphones in a couple of years, because I was running advanced consumer electronics at Facebook and at Google. And so the key thing that nobody was using on them is the fact that the pixel sizes were approaching the wavelength of light. Like, there's all this discussion of Moore's law, and like, that's a disconnect in Moore's law, like in what you can do in the physics. Because then you can capture the waves and the wavelengths of light, or the phase of the wave. And by phase, I mean, think ocean waves, the crest or the trough, or the part that
the ups and the downs,
right?
Yep.
So that is fundamentally an information theory. That's what the invention of holography was initially, is how do you capture not just the intensity of the light, but the phase through interference. And so I thought that we can make holograms of your body. And this seemed crazy, but I thought,
interesting. So that kind of connects to the early days. And
that and having a brain tumor, which we skipped over. Like, I had to so I was just interested in why is medical imaging? Like, I saved my life in 1995. Somebody sprung for the cost of an MRI. I was going to go home and die nobody knew I had a brain tumor. So I was happy to have a diagnosis. When you have a diagnosis, you can solve it. I had to do all kinds of things every day still to care for my brain, but I've made a better me, and we can talk about that. I did biohacking before it became a thing, but missing a part of my brain means I have to.
I figured that would come back to this part of the conversation, so I didn't bring it up earlier.
Oh, no. But the thing about it is, I look at those MRI machines, they're the same cost, the same size as they were 27 years ago when they saved my life. And that's just crazy. Could you imagine that in consumer electronics? And that's because, what do you do with the 2-ton magnet? I mean, a lot of people have tried. There's actually a company now, Hyperfine, but they're making it a little smaller, but the resolution's not good. So there's some trade-offs, but I just thought it was time to look at what we could do using the $1 trillion manufacturing supply chain to make healthcare really good. Pandemic, of course, hit in the last 2 years. We're moving to decentralize. Why can't we have these devices at home that are diagnostics and therapeutics without drugs? Not just, and I don't mean to dismiss how you're using your cell phone, that's important, but we might be able to cure Alzheimer's, cancer, brain disease, all kinds of things as part of many other things that are going on as well. We have some different approaches, and I think it's interesting to see how we'll all mesh.
So there's a couple of different aspects that you have to kind of reinvent, or, advancements. I mean, you mentioned kind of on the chip side, correct? On, kind of ultrasonic side. I mean, tell us a couple of aspects of what you're pushing the envelope on that is going to deliver this vision for you.
So sometimes you get lucky. Apple and Google decide to ship a chip that you want to use exactly as it is, and it costs $1.
Oh, that's great.
Yay, that's where we are. Although we get charged more than $1 for it, but not that much.
Yeah, of course.
Because we don't have the same volume.
Right.
But we had to invent an impossible laser that pulsed with coherence at the right wavelengths, so that we could make holograms onto this camera chip. And that a couple of years ago was the size of the room and $500,000. We've now reduced it to this size. We've got a prototype this size to move it to mass production. What people don't probably realize is that in both their iPhones and their Pixel phones, that's the name of the Google phone, there's 250 lasers in it, IR lasers that scan over your face to record with structured light a 3D vision of your face, so that a picture of you can't unlock your phone, but a face can't. So that's a good use of some of that technology. But the thing is, that's there. 250 lasers, VCSELs. 20 years ago, those lasers were $100,000 a piece. And so basically, we're trying to ride so the lasers we're putting on into silicon processes. There's no reason their cost structure doesn't have to be much different. But what we could see with that is extraordinary detail of blood flow. And that ends up being super important for something that gives $1,000 per diagnosis, but when it's too late. And that's for the number 2 killer in the world, even amid COVID, which is stroke. And so we can detect strokes quickly, and that matters because if you have a severe stroke, if you can get a thrombectomy, if you can get the clot surgically removed, because drugs don't work for a large vessel occlusion, which is a severe stroke, there's 90% chance of no neurodeficit whatsoever for something that right now either kills or severely permanently disables 60% of the people that have it. And that's 30–40% of all strokes. So it's huge because that's the number 1 cost of long-term disability. And every 5 minutes you can save, there's huge. So we're detecting stroke first. Then we've got a system where we think we can start to loosen the clot, but that unit also does neurostimulation where we seem to be growing nerve cells for Alzheimer's on a microscope chip, and also bursting cancer cells, fast growing cancer cells, killing them without. So we're working on things that can be very low cost, that we're developing with an eye to what can go into high volume mass production and not have to be in the hospital, be at a cost structure that's low, but also replaces existing therapies that are flawed. Like right now, if you have Alzheimer's, you go 5 days a week to a hospital for 6 weeks to get a therapy. That's really hard for an Alzheimer's patient. And can we get something at home that's more accurate, focused, and productive? And the early results are extremely promising. So we'll see how those pan out this year. We should be in human.
I think it's very inspiring, and pieces of it. So one of the things we've been doing a lot of investing in, about 40% of our portfolio, is proactive healthcare. And actually, I've got friends and relatives that are doctors, and they say everybody's been talking about proactive healthcare for a long time. But I think that we're finally at a cusp, and what you're sharing and your plans is basically that. And so, correct me if I'm wrong, the initial product that will go to market when it's ready be for the home, or is that a longer term?
Well, we have 5 products in our pipeline right now. So the first one is a stroke detector. We're testing in hospitals now, comparing our data to the MR data and so forth, so that a paramedic or point of care place can use it, because every minute counts. When you have a stroke, your urgency is the same as somebody with a gunshot or a stabbing victim. It's just not apparent that you have that. So that'll go to urgent care, EMS, et cetera. And then to which we plan to add something that starts to loosen the clot on the way to therapy. And then ultimately, with all that data, honestly, why does anybody have to have a stroke at all? Can't we predict it before it happens? Because I don't know, did you ever take fluid mechanics? I did. Like, you get turbulence when there's something blocking before it blocks completely. Like, think of whitewater rafting and the rocks. You can see the water around them, like that's the turbulence. So we think we should be able to see that and predict it prior. That's a whole suite of things for stroke. But then fast-growing cancer, it turns out the cell membranes of a fast-growing cancer are really hard, and they've got bigger nucleuses. And so what we found is and the literature supports this, is we can selectively kill fast-growing cells with hard cell membranes and keep the healthy, slow-growing cells in your brain that you've had for most of your life perfectly fine. A bit like a bridge can withstand an earthquake, but opera singer can, with the right note, burst a wine glass, but nothing else in the room. So we can burst and kill those cells. And that's, there's no known cure for glioblastoma or these fast growing cells where it's like an octopus in your head, like one cell will hide in these other cells. It's very hard to get. Right. So that unit that can do that at a different frequency seems to be growing nerve cells in Alzheimer's. All of this without, here's the thing, there's like 250 drugs that have been tried for Alzheimer's, each cost an average at $1 billion, and none of them work. None of them work. So it seems crazy to try, non-drug solution, but really, because it's just not working, because the blood-brain barrier, it's hard to get in the head. We can stimulate. And so that also is useful potentially. And we're starting to explore this with some clinicians for mental disease. Repetitive negative thought leads to anxiety, OCD,
Sure.
PTSD, ultimately depression, which are huge issues. And we can objectively look at the brain and see what's going on, rather than DSM, where you just answer a series of questions, like a litany of questions, diagnose you with depression or not. Like on that list are, have you gained weight? Are you not sleeping? Do you have thoughts of suicide? If you answer yes to those and others, you're clinically depressed, and you're no longer depressed when you answer no to them. Instead, can we see what's happening in your brain? Because basically, like if you come out of a coma, you need some stimulation on your muscles to get your muscles working again. We need some stimulation on our brain to get our brain working again.
Yeah.
A bit how psychedelics are being used, but without the psychedelic, maybe that's less fun, maybe it's more fun. It's more targeted, because we can target the exact part of the brain at issue and stimulate it. And perhaps another therapy, we'll see.
I mean, obviously, each one of those is a huge opportunity in and of itself, let alone 4 or 5 different product tracks, which is very exciting. We've got a lot of entrepreneurs in the audience and aspiring entrepreneurs, and that's kind of our world, obviously. Of the ups and downs, not only pushing the envelope technologically and your passion and determination, like, in the lowest of lows, how do you get to the next stage, or get yourself and your team to the next stage without being overwhelmed, or stopping? Or it's one of those kind of questions of the entrepreneur in you. And are there tricks that you have in the normal ups and downs to help manage it?
Yes and no. I mean, I've been there with the blankie and the bottle of tequila, except I don't like tequila, but, it's a metaphor.
Sure. We've both been there. Yeah.
But I have to take a dozen medications every day to live, every single day, since that part of my brain, I don't have a pituitary gland, and adrenaline is a key hormone. Cortisol is a key hormone. And so I've had to fight so hard to live. And so what do you want to do with the time you're alive? Sure, you can take a week and wallow and
right.
But ultimately try to figure out what I could have done better. There's macros you can't control, but what can you do next time? And what gives you enough passion to throw yourself back at it? Because we're alive. We get to live now. We get to be here. There's so much things that can be done. And it's really fun to work on something that's seemingly impossible, make it possible, and get the people that want around the world that want to also make the thing possible and work with them. It's the most fun of a way to spend my time. And, I can't think of.
And it sounds like that was a big decision as far as, yes, you mentioned earlier before talking about Openwater, the VR and AR, and that was a big part of your past, but kind of working on almost a bigger, more impactful, everybody has a different perspective and there's no right or wrong, but there is such a, tremendous impact that your Openwater has plans to hopefully improve many aspects of healthcare and people, which I think is fantastic.
And amidst the great resignation, you have people who think they have enough, their belly's full, so to speak, they've got abundance. And so maybe they should just take it easy. But and if you've been working your 100-hour weeks for a decade, maybe you should take a little break. But, honestly, what seems to be true across the studies is that, you're just not as happy. You're not as fulfilled. And so taking a break, right, with your family, whatever, switching up to a new career, like learning something adjacent or even completely diametrically opposed, might be the way, and trying 5 things on for size, seeing what fits, and going with that might make sense. But yeah, pick yourself off I mean, come on, everybody's been through. Some people have been through worse hell, but yeah, I mean,
that's true. I agree. Let's skip. We got a couple minutes left. And we could talk forever, Mary Lou, but I always try to get have surface actionable insights and advice for the audience and help more people build more successful business to help more people in the world. And so you've started several companies. The second and third and fourth people on those teams, are there certain types of people or personalities that you think are most valuable to find for you? I mean, everybody's different, but what type of people are the ones, oh my God, I have to work with this person, as one of the first 3 or 4 people of a new company? How do you decide?
Well, I do hard tech, and I think a lot of you do. So I don't go for the business people early on.
Right.
Just what I'm very technical, but I look for people in areas of weakness where we can really communicate well. I made a list for this, so find it. I can just tell you. I mean, just they have to sort of fight fair. And like the other thing is because you will come into this. I remember working with one of the best guys I ever worked with. I'd come in the morning and say, I'd have an idea. And well, we're getting our coffee in the morning. And he'd say, there's no way in hell that's ever going to work. Such a stupid idea. But by lunch, I would have gotten into his head. And he was really good at things I wasn't. By lunch, you say, that thing you're asking, there might be a way. by dinner time, we'd have a working, idea of how to do it, because he'd understand the impact we could have if we could invent in this area together. And I just love working with people like that are really good in other areas. And then we share these spheres that we cover. And so we can do more as we span out, because he again could debug in his head all the reasons it wouldn't work, a bit like an executive at a big company in consumer electronics, so you can go faster. So I think it's a mix of agnostic, like not having a religion, it has to be this kind of AI or that kind of AI or whatever,
right? And
kind of fearless, but the different abilities and developing that trust through those experiences, right, of that happening repeatedly. And sometimes it's not going to pan out, and sometimes it will, right. But it will always not pan out if you don't try it at all. Makes sense.
What would be the last question? We can keep talking for a while, but I want to kind of, package it all up. What is your advice, or what would be your advice for that deep technical person who's a researcher now, or in school, or has been worked in a couple of big companies, but wants to start a business, but hasn't jumped? Or, what would your advice be to them to help them decide if and when to jump to start a business themselves?
Right. They probably think it's safer at the big company for some reason.
Yeah.
At Google, people change jobs every year. They last less than 2 years.
You mean within Google, they switch to different groups?
They switch to different groups every year.
Yeah.
And so the longevity of purpose on a project is longer at a startup statistically. So if it's something you want to do, you're probably going to get switched around from project to project. It meets the corporate goals. That the projects will probably be interesting. It's really good to learn. That's a fine way to approach. Like they can scale things like nobody, or pick your company, Facebook, Microsoft, sure, whatever it is. But if you really want to do something, you might think it's unsafe. Like my first startup, I literally started a month after having brain surgery, not having been able to afford. And I know I keep bringing this up, but it formed like, I with my co-founders, I was like, I can't do this. I need health insurance. And what they said is, you seem to know a lot about health insurance. Why don't you pick the health insurance? And I'm like, oh yeah. So I just got the most expensive health insurance, and I still do, because why not do that at a startup? Because there's more risk. Because you really don't know if it's going to work or not. And it's not like you can switch. You might be able to pivot, but you're not going to get reassigned to some other place. But you get to stick with the project. You know what's going on. You have a lot more visibility in what's going on. If it's a well-run startup, everything should be shared with you. The board decks, the finances. Sure. You should know how much money's in the bank every week. You should know all that. It's just a lot better, because with more information, you can make better decisions. at the early stages. It's harder to scale.
And also have more impact, likely as well. I think that's a fantastic advice to close on, Mary Lou. This has been fantastic. I wish we had much more time, and I appreciate you sharing your insights and thoughts with us. And we're looking forward to Openwater being a tremendous success and improving people's health around the world. Thank you very much.
So impressed with all you do at LDV, and I've learned a lot.
Thank you
for everything, all the stuff and believing in visual computing and all the incredible people you brought together. Thank you.
Thank you very much.